Thank you, Mr. Speaker. Good afternoon, fellow colleagues, to all listening to our August chamber. The healthcare sector in our country is facing an unprecedented crisis due to the massive exodus of our healthcare workers to first world countries. And while it brought me a sense of pride to see that two Filipino nurses were invited to King Charles' coronation, the truth is we are losing our healthcare workers to better paying jobs with better working conditions abroad. Recently, my brother-in-law experienced a painful medical procedure due to the medtech's lack of expertise in handling patients with small veins. It took her several tries before the procedure was finally successful, causing him bruises on both arms for a whole week. They were not successful in drawing blood, so he was asked to come back the next day when a more senior medtech would be around to draw his blood. On the other hand, during my recent visit to the hospital for a blood test at a private hospital, the medtech drew my blood painlessly. When I commended her and asked her how long she had been working there, she replied, 3 years. I encouraged her to stay longer, but she revealed that she had already applied for a job in Canada and was just waiting for her papers to be processed. She cited better pay and opportunities as her reasons for leaving, which is a common story among healthcare workers in our country. This medtech was very young, maybe only in her early 30s. I asked her, how do you think we can address the problem of our country with so many healthcare workers leaving? And of course, her first response was, better pay for all healthcare workers. And her next suggestion, sana po holistic ang pagtingin ng gobyerno sa lahat ng HCW. Hindi lang po sa mga doktor at nurses, kami pong mga medtech, people who draw blood, at mga radiotechnologists, people who perform x-rays and read CT scans, to name a few, madalas po kami nakakalimutan. In short, ang gusto niya, sana all. She told me that her gross pay was $25,000 a month versus a nurse who was making $34,000. And while she recognizes the differential in salary grade due to hours worked and responsibilities given, she said the disparity shouldn't be too big. The Canadian hospital she was moving to would be giving her more than 2,000 Canadian dollars, or roughly 82,000 pesos per month, more than a 200% increase from her current salary. And this is even on the lower end of the salary scale in Canada. In 2010, long before the COVID-19 pandemic, the World Health Organization adopted a global code of practice on the international recruitment of health personnel. This was in response to the mass exodus of healthcare workers from countries in Africa suffering from the AIDS epidemic. To address this exodus, governments of these African countries channeled public funds to educate more doctors, nurses, and healthcare workers, and while they were producing enough graduates, these graduates were being hired by richer countries with better offers than their country could never match. It is to be noted that the WHO Code does not impinge on an individual's right to migrate, but it appeals to the wealthy nations to recruit through bilateral agreements and to work with the health ministry in the countries of origin. In exchange for an organized recruitment of health workers, the destination country should supply support for healthcare initiatives designed by the source country. Destination countries are also supposed to offer learn and return, in which healthcare workers with new skills return home after a period of time. Unfortunately, more than 10 years later, This global code of practice on international recruitment of health personnel is not being implemented. In fact, there are foreign recruitment agencies that physically come to the Philippines, talk directly to the healthcare workers, offering attractive benefit packages and even financial sign-on rewards to lock in the commitment while the work and immigration documents are being processed. Given the huge differential in salary, more than 200%, how can our health workers resist the offer for a better job and probably even a better life abroad? According to Dr. Giorgio Cometto, an expert on health workforce issues working in the World Health Organization, the migration of healthcare workers from low-income countries to high-income ones has increased by 60% from 2006 to 2016. This problem has only worsened due to the COVID-19 pandemic, which highlights the urgent need to act quickly. As policymakers, it is imperative that we act to address the mass migration of our healthcare workers and the negative impact this is causing to our country's healthcare sector. To address the shortage of healthcare workers, we must implement a policy and program framework that emphasizes the production and retention of skilled workers, along with regulating the private agencies involved in recruitment. This should involve investing in education and training programs for healthcare workers to ensure a steady supply of skilled professionals, as well as offering competitive wages and better working conditions to retain them. It is also important to strengthen regulation of recruitment agencies and establish bilateral agreements between countries to manage the migration of healthcare workers as expressed in the WHO Code. These agreements must have a financial component. For instance, we can require these foreign countries provide educational sponsorship to finance the studies of Filipino students entering the medical field. We must find ways to alleviate and address the effects of the aggressive recruitment strategies by foreign countries. Lastly, a comprehensive database on healthcare workers should be developed to help plan for workforce needs and develop policies that benefit both the healthcare sector and workers. The evidence from the number of healthcare workers who have migrated is clear. These numbers will only increase as time goes by and will imperil our already fragile healthcare system. During the Appropriations Committee meeting last week, it was revealed that in 2020, there is already a shortage of 127,000 nurses and 104,000 doctors annually. This is most alarming as we only produce 4,387 doctors a year and 10,645 nurses annually. If we act now to involve the governments of these countries to participate in the proper and fair recruitment of our healthcare worker, combined with the obligation or commitments on their part, we can reap economic and social benefits while protecting our health sector and ultimately the well-being of all Filipinos and the generations to come. The fragmented approach towards resolving the migration issue, combined with a lack of urgency, has only made the problem worse. We must fully articulate the predicament of our country and the urgent need to address the challenges faced by our healthcare workers. We Filipinos, not just our healthcare workers, need to reignite, reawaken, and renew our love for our country. Ang pagmamahal sa bayan, paglilingkod sa kapwa, pagseserbisyo mula sa puso, tunay at tapat na pananampalataya, ito ang mga dapat umiral sa bawat Pilipino. Unless we start with this as the foundation of the service we give, then no initiatives by our government, private sector, regulatory agencies can be sustained. While we understand and respect the valid reasons why some Filipinos choose to migrate, we must also recognize the impact it has on our country. We owe it to our healthcare workers to provide them with better working conditions, wages, and opportunities. We must work together to build a stronger and more resilient healthcare system for our country. If we delay and allow the disappointing trend to continue, we are risking the future of our nation. Health is wealth, Mr. Speaker. We must act swiftly before the pandemic strikes. Magandang hapon po.